Dr. William Starsiak here with Starsiak Osteopathic Clinic, and here you see me preparing a patient's abdomen to treat with platelet-rich plasma diastasis recti. Now, we already used high-intensity focused electromagnetism to reduce it by about 50%. The PRP will help reduce it even more. Prior to the cleansing, I did an ultrasound to ascertain the exact depth and to confirm location was consistent with my palpation. So depth was right at an inch. That's where we have that fascia meeting the medial edge of the rectus. You've seen me here palpating that medial edge. I have a needle tip on there that is 1.5 inches, so I'm not taking the needle all the way down to the hilt. I'm just taking it down about 1 inch until I palpate the fascia at my needle tip. And I aspirate to make sure that I'm not in a vessel, and then inject 1 cc. Of course, the PRP is mixed with lidocaine. And I continue this process along the edge of the rectus, spacing out injection spots about 3/4 of an inch, and doing it on both sides. So I simply have her contract, and then I palpate again for that medial border, in this case of her right rectus. And since I did the ultrasound beforehand, I know the depth. That is the key thing in this. Now, with the needle size that I have on, I'm not going to be able to get to a dangerous depth. I'm not going to be able to get through the muscle wall into the abdomen. So that's an important thing to keep in mind. There's no need to have, a needle bigger than, in this case, it would be 1.5 inches. So the rest of this video is going to be pretty repetitive. You're going to see me continuing to move down the right side, palpating that medial edge of the rectus muscle, having her contract when I need assistance with palpating it, and then positioning the needle right at that medial edge. And the key is learning to be able to palpate with the needle tip to sense the different tissue textures. I'm an osteopath, and my main practice is osteopathic manual medicine. So I have quite a bit of experience in palpating different tissue textures. And with the needle, you can palpate through it, actually. So you can feel when you pierce the skin, and then the quality of the subcutaneous tissue. And if you ever have done intramuscular injections, you can feel that transition into the muscle. There's a change in resistance. And if you have ever done any intramuscular or, say, aesthetic facial injections, when you pass through fascia, depending on how thick it is, you have some resistance there as well. So in this region, you really need to be guided by your palpation through the needle tip. And it's important to know about what are the potential risks. If your needle is not long enough to puncture the abdomen, then that's not a risk. So if you do an ultrasound, you can ascertain the depth of that fascia at the medial border of the rectus. Then you're going to choose a needle that's an appropriate length. Now, there's always a possibility of occluding an artery or a vein by injecting into it. That's why you aspirate. That's going to reduce that risk. In the anterior abdominal wall, you don't have any big nerve bundles that you're going to be able to damage with this needle. Any little nerves that you damage, most likely result would be that they are just going to grow back. But it's really rare to actually even damage any nerves in this way. I've personally never had it happen to me. I just know it's a theoretic possibility. Infection is always a risk, no matter what you're injecting, where you're injecting. If a needle is going into the body, infection is a risk. I bet if it was studied, PRP actually reduces that risk. If you just injected normal saline versus injecting PRP, I bet PRP reduces the risk because it does put the immune system on alert. And depending on how you prepare it, you're going to have some immune cells in it. So this is an excellent combination, a fantastic way to close diastasis recti non-surgically. You ideally get weight loss, and so now we have these GLP analogs, semaglutide, tirzepatide, retatrutide is coming out. You have high-intensity focused electromagnetism. The leader in that space is BTL with the M-Sculpt and the M-Sculpt Neo. Those have been researched and shown to reduce diastasis recti by 50%. And then you have the platelet-rich plasma injections, which will help reduce it even further. So a really good comprehensive approach to have all of those at your fingertips if you want to address diastasis recti. So if you have a patient population with a good number of mothers, of women who have been pregnant, well, you have an increasing risk of diastasis recti in that setting. So that would be a good situation to have these. After this, a patient should be reasonable with their activity, avoid any really heavy, vigorous activity that's going to increase intra-abdominal pressure majorly. Like, it's okay if they do a little bit of that, but, in theory, it makes sense to rest the area while the stimulus is active and the fibroblasts are repairing. And then after that repair has already mostly finished, that's a good time to start providing the stimulus that will then get the body continually remodeling that area. So maybe about a month period before really trying to do any sort of intense core work, if that's what someone wants to do. Because they should, begin to see improvement in a month and see most of it by 3 months. If you enjoyed this video, press the like button, be sure to subscribe, and if you'd like to have access to a ton of PRP videos, like here's another example, like an intra-articular shoulder injection, all sorts of different joint injections, intra-articular, ligamentous injections, tendon injections, well then you can become a monthly member to get access to all of that exclusive content, and it's really inexpensive. I think it's $3.99 per month for all of this fantastic PRP training content, how to make PRP as well. So there's really no reason not to do it if you're looking to get more knowledge with preparing and performing PRP injection procedures.